Hi, I'm Steve Adubato. Thank you so much for joining us. We are honored to be joined by Dr. James Wittig, who is in fact Medical Director of Orthopedic Surgery, Orthopedic Oncology and Sarcoma Surgery at Atlantic Health System. Good to see you, Doctor.
Good to see you, Steve. How are you?
I'm doing all right. Put this in perspective. Orthopedic oncology is?
Orthopedic oncology is a surgical specialty in orthopedics where we specialize in removing sarcomas of bone and sarcomas of soft tissues and limb-sparing surgery for those types of tumors. So basically cancerous tumors that develop from the muscles and bones where you remove the cancer and save the limb instead of performing an amputation.
So let's talk about virtually everything in medicine and healthcare as it relates to COVID. We're taping on the late end of October 2020, and it'll be seen after. So lumps, bumps, right? I've had these lipomas, had dozens of them taken out, another one over here. I'm like, every time I get one, I freak out, right? In the age of COVID, whether it's me or anyone else, should we be getting every lump, bump, whatever, checked out? A, B, is it safe?
So Steve, let me answer the second question first. It's totally safe. You know, when you come into the hospital and you see me or you're going into other doctors' offices, everybody's taking appropriate precautions with proper mask wearing, face shield wearing, social distancing. When you're not in the office, we're practicing social distancing with the rest of our staff and wearing masks, etc. Thorough hand cleansing between patients. So we're getting tested on a daily basis, having our temperatures taken. So it's very safe to come into the office. Yes, you should take all your healthcare problems very seriously right now, particularly lumps and bumps. I'm seeing a lot of patients who sort of failed to go to the doctor because of their pain or because of a lump that they felt and dismissed it as maybe a muscle pull or tear. And they delayed this between March and let's say July, and now I'm seeing it and it's a very big tumor or the bone has been destroyed and it's a lot bigger operation and a lot more serious situation at this point.
Don't put it off.
I would be expeditious about getting it taken care of.
So don't put it off, right, doctor?
Oh, do not put it off.
Don't self-diagnose. Don't go on the internet and try to figure out what, by the way, all the things that I do, that's why I'm raising this.
No, sure. The tendency is to dismiss it and be in denial and say, oh, you know, it's just a lipoma. It'll be okay. But in all honesty, you really can't tell that something's a lipoma for 100% certainty unless you get an MRI of it.
Yeah, and by the way, a lipoma is just
remove it and biopsy it.
Yeah, just so people know why I'm obsessing over this. They're fatty deposits. My late dad gave that to me as a gift based on genetics. I just want to share that. Telemedicine. Someone says, okay, I got this bump, I got this. Doctor, can you look at where does it work well, doctor, and where do you need a face-to-face physical examination?
So I think telemedicine has been great, especially with COVID. Prior to COVID, I had been wanting to expand our telemedicine capabilities with orthopedic oncology because it really expands the access of patients to the doctor. Think about, you know, a little 80-year-old woman who perhaps has to travel an hour and a half to see me and get a lump examined. Well, she could go locally, get an MRI done, send the MRI up to me, I can check it out, and I could take a look at her on the video camera, and we can discuss. Do I need to do a biopsy? Do you need to come in and we just remove it in the operating room? So there's a lot of planning and surveillance and sort of screening that we can do via telemedicine.
Do you see it being, again, it's being used more than ever during COVID. Do you see it, even as we make progress around COVID, that telemedicine, telehealth will be an even bigger part of the healthcare landscape?
I think it really should. I mean, I think it would be a mistake to now go backwards after this, after we've learned so much and learned how helpful telemedicine can be during this process, for us to go back to all the very stringent rules and regulations and being unable to bill an insurance company for it, et cetera. I think that patients really need to have this access, and it really, I think it improves their care and enables them to see specialists that maybe perhaps they weren't even aware of that they could see.
By the way, let me disclose that the Atlantic Health System, one of the many healthcare systems that are underwriters of the work that we do. Last question before I let you go. How optimistic are you around the fight against COVID, A, and B, the future of the healthcare industry?
So I think, I think we're going to make it through COVID. We're making a lot of progress with various vaccines and other treatments to minimize the effects of COVID on patients. And patients we know a lot more now than we did, and patients are being successfully treated and managed. So I think we're going to see a lot less deaths from it, and a lot of patients managed much better. The future of healthcare, I guess that remains to be seen with the new election coming up and a lot of other changes. So I have a positive outlook no matter what. I think we have the best medical system in the world, and I think that we have a tremendous healthcare team and healthcare workers that are really dedicated to taking care of patients, as we saw with COVID.
Well said. By the way, we're taping on the 22nd of October. It'll be seen after that, so we'll see what happens politically and its impact. Doctor, thank you so much for joining us. We appreciate it.
Thanks, Steve.
I'm Steve Adubato. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, PSC&G, MD Advantage Insurance Company, ADP, the Healthcare Foundation of New Jersey, the Northward Center, Johnson & Johnson, NJ Best, and by the Adler Aphasia Center. Promotional support provided by CIANJ and Commerce Magazine, and by NJ On Air.
Choosing a new family doctor can be confusing. Check with your health insurer to see which physicians near you participate with your plan. Find out which hospitals the doctor uses and who covers when the doctor is away. And remember to schedule an appointment with your new doctor in advance to fill out any paperwork without the added stress of being sick.